Good morning, good afternoon, good evening, wherever you are. I am Dr. Akwiasenbang, an interventional gastroenterologist at Massachusetts General Hospital, and I'm also the co-founder of an organization known as POHER, the Pan-African Organization for Health Education and Research. So October is Liver Cancer Awareness Month, Cholangiocarcinoma Awareness Month, and just Liver Disease Awareness Month in general. And we recently had a talk on cholangiocarcinoma, and I was thinking about the audience. And, given that this was live streamed, I thought, well, it's possible some people who are listening may not necessarily know and understand the basics of the liver, even though the target audience was physicians, individuals in the healthcare field who take care of patients with a liver disease, or just anyone within the healthcare field. But anyhow, I thought to just make this quick video. It's a very, very basic information about the liver. So hopefully you find it helpful. As mentioned, it's just going to focus sort of on the basic anatomy, just so at least you can get a sense of where the liver is, blood supply, functioning, and then we'll go from there. We get multiple lectures about the liver, and so I'm going to give you more like a 5-10 minute lecture about the liver. So let me share my slides. Let's see. Okay, so hopefully you could see my screen. Put in slideshow mode. Okay. All right, so here we go. So, another thing is that these images are not my original images. I got all these images online, so I just copied and pasted. And what you'll note in some of the slides is I repeat the images, and that's to make a point, meaning I use different images to make the same point, because that's what you might see online. Anyhow, so in this first image, as I'm starting off, the liver is located on the right side of the abdomen, so right beneath the ribs, the lower right ribs. And the liver is truly a fascinating organ. It's one of the largest organs in our body, and it does so many things. So this image, what I wanted to show you before getting into exactly what the liver does is, as noted, the liver is surrounded by other organs, and I'll get into a little bit more detail. And the significance of this is that, if a surrounding organ gets sick, then the liver could also be impacted. Or if the liver gets sick, then the surrounding organs could be impacted. So it's always important to understand the anatomy and things that are in that vicinity. So, you may have, let's say you've got abdominal pain, and the abdominal pain is on the right side. Well, you'd look on the right side and you'll see, well, what other organs are sort of on the right side? So you have your liver there, and you also have your gallbladder. The reason it's important to know the location of the organs is it helps us with what we call a differential diagnosis, meaning it helps us sort of narrow down what are the possible causes of these symptoms and what workup should we do to try and help you. All right, so back to the basics again. So some of the things that the liver does is it's involved in digestion, meaning it has substances, fluids that help break down the various nutrients that we consume. It's involved in secreting bile. It's also involved in breaking down, or as we say, metabolizing various drugs to make them less toxic for us to consume. So these are some of the very basic things that the liver does. And these are very, very important things that the liver does. And so this image, once again, it's to show you the anatomy. So over here, what you can see is the liver, and it has a couple of lobes. And then on the liver, you've got ducts. These are known as the bile ducts. So this is a pipe that comes out from the liver down into the small bowel. Then you also have a gallbladder, which also has a pipe, that's the cystic duct, which connects to the pipes that came out of the liver. So on this other side, which is the right side of my screen, what you have is the liver. And then within the liver are all these multiple pipes. These are known as bile ducts. Remember, we were talking about cholangiocarcinoma the other day. So cholangiocarcinoma is that cancer that can affect these bile ducts. So when the speaker was talking about the cancer within the liver, this is intrahepatic. So these pipes within the liver could be affected with a cancer. When we talk about the cancer outside of the liver, this is extrahepatic. So this pipe outside of the liver could be affected by cancer as well. So as you can see, the multiple pipes within the liver, that's the bile ducts, they all come down and then they connect with the pipe that comes from the gallbladder. So that duct coming from the gallbladder, and then it forms one main pipe, and then it drains into the small bowel. So that's what this is, okay? And some of these may not be anatomically perfect, but I'm hoping you get the message. So let's look at it again. So similar image. This is the liver. Okay, it has the two lobes. You have a right and a left lobe. And then these are the bile ducts. So you've got a duct inside towards the left, and then you have a duct towards the right. They meet, come down, then they join this duct that's coming from the gallbladder. That's the cystic duct. When they join, then it forms what's known as the common bile duct. And then that comes down and opens into the small bowel. So when bile is flowing, it flows all the way through this duct and then comes out here into the small bowel. And then the pancreas also has a pipe, which is known as the pancreatic duct. Now, remember I was talking about the relationship between the organs? So for example, let's say your pancreas gets really ticked off. You end up with like pancreatitis, or let's say you have something such as a pancreatic cancer. Now, if the cancer is at the head, so this is like at the top of the pancreas, it can cause a blockage of this bile duct, okay? And when it causes a blockage of this bile duct, what happens is the bile is not able to flow out as easily. So what does this bile do? It backs up into the liver, irritates the liver, and in some people, what you'd notice is that their eyes may turn yellow, their skin, their body turns yellow, or sometimes what could also happen is but in addition, not only does someone turn yellow on exam, but when you check their labs, there's something known as a bilirubin that would be elevated. So my point of this slide is just to show you this is the liver. You've got the gallbladder. It has a pipe that joins the pipes that are coming out of the liver. So that's the bile duct. And then this bile duct, we call it the common hepatic duct that's coming out of the liver. After it joins that pipe, the duct from the gallbladder, it forms one main duct known as the common bile duct. Okay? And so significance of neighboring organs, if let's say the pancreas is inflamed, the pancreas is angry and causes a blockage in this pipe, that can cause the bile to just back up, and then some people turn yellow. And the reason I specifically mention the head of the pancreas is sometimes you can have a disease in the pancreas that's in the tail of the pancreas, but look at it. It's so far away from the bile duct that you don't necessarily expect a tail lesion to cause a blockage over here. So when you think about it, when we're thinking like, well, why is someone yellow? What's wrong with their pancreas? Why are they not yellow? You think about relationships of these organs, okay? So like I said, there's a lot of other organs nearby. My focus for today is just the liver. And so I'm going to repeat it over and over again using different images to make my point. Once again, liver, you have these ducts. These are the pipes. They come down. They join the pipe from the gallbladder, come down. It forms one main pipe, and that opens up into the small bowel. Okay? Now, this image shows it even in different colors. Shows you this is one lobe. This is the right lobe. And yes, there are different sizes in the lobes. And this is the left lobe of the liver. In real life, these are not, these colors that you see on the imaging. The point of the imaging is just to highlight these different organs. I'm hoping by the end of this, you'll be good. You'll be like, yes, I know the liver. I know where the bile duct is. I know where the cystic duct. I know the gallbladder. I know the common bile duct. But anyhow, so these colors are just highlighting the points I've been mentioning. So you've got the liver, you've got some ducts. The ducts will come out of the liver. They come all the way down and they drain into the small bowel. And so you can get a cancer within these ducts. And the cancer we were recently talking about is the cholangiocarcinoma. All right. So here's the other fascinating thing about the liver in terms of the blood supply. So the liver is actually supplied by two main vessels. You have a portal vein, and the vein, interestingly, supplies a majority of the liver, and then you have a hepatic artery. So the other significance of this is, if let's say that there was a blockage in this vessel, that would have a huge impact on the liver. Okay? So that's the importance of knowing what blood vessels are supplying what organ. Because if that blood vessel is affected, then the organ it's supposed to supply, the organ it's working with, will also get affected because that organ is either not getting the blood it's supposed to, or that organ is not getting cleaned out like it's supposed to. Okay? Because blood vessels carry the good oxygen, but blood vessels also help to carry waste products. All right. And so I thought to bring everything sort of together where you can see the liver, you can see the bile ducts, those are supposed to be the greens, and then you can see the vessels. That's what the sort of purplish, bluish, and the red. So you can see the significant vascular system of the liver and the significant biliary system of the liver. And then you could see the relationship of the liver to the stomach. You can see the relationship to the pancreas. You can see the relationship to the spleen. And then you can also see the relationship to the small bowel. And we can get into all these things later. So now this should probably be my final slide. But what I wanted to show here is the transition, right? So this is what, quote unquote, a normalish liver would look like in terms of sort of this nice, smooth surface. Now, this image, these are different bits of different parts of a liver. This is not like the same liver. You don't see this transition on the same liver. This image is intentionally just trying to show you the path the liver would take in terms of the damage. So if, and they used an example of alcohol because that's one of the most common, the most common toxins for the liver. So if someone consumes a significant amount of alcohol, your liver can take it for only so long. After a while, your liver's like, you know what, I just can't do this. This is a bit much for me. And your liver just breaks down. And so when it does, it kind of goes through this process, and there's certain stages where, things can remain stable. Things are potentially, could potentially heal. But it reaches a certain point. So it goes through these stages where you have the inflammation, the hepatitis, the inflammation, then you have fibrosis, which is the scarring. And then you end up with cirrhosis, which is generally end stage liver disease. This doesn't go back. And then in some, that can progress to a certain type of a cancer known as hepatocellular carcinoma, HCC. And for some people, what this image is showing is the considerations for liver transplant, depending on the patient's overall state of health and the evaluation. And in some people, unfortunately, they would die. And so things that impact the outcome is if you continuously abusing the liver. Like I said, the liver can take it for a little bit, but after a while, the liver's like, you know what, you just can't do this. And when you look at this image, what it's showing is, we see here it says consumption. So I'm just going to help you interpret some of these images. So it's showing consumption, which means if you continue to consume, you're going to follow this pathway and eventually end up with this HCC. Now here you were consuming, but if you stopped, then there's hope for your liver. So you see how the arrow is going back this way? There's hope for your liver. Okay? All right. So hopefully this made sense. Once again, the whole point of this lecture was just to kind of give you a brief overview of the liver. And the key thing was, since we just had that discussion about cholangiocarcinoma, I just wanted to spend just a little bit more time just to talk about the anatomy of the liver and just to really, really show you, where these bile ducts are. All right, I will stop there and hopefully you found this very useful, and have a great day until we do this again. Thank you. So let me stop sharing and stop recording.